Okay, I'm gonna do just a quick demo on how to easily and properly restrain your dog, and this is how I start to condition my puppies to tolerate restraint and also to yield to leash pressure. So this is the beginning of my leash breaking. So I start with a little puppy. It's the day that I bring them home, probably with the hour I bring them home. That's how important this is. I want them on a flat buckle collar. And preferably, if you can find it, I much prefer a buckle collar to the stupid quick release collars, because the quick release only releases when you need it not to and you try to grab it. And it also constantly is loosening. So it will, every dog I have come through here on a quick release collar, almost all of them will slide right over their head because they've released over time. And a lot of times they won't hold. So when we start out, we just put your puppy or your dog or your puppy up on a table or your washer, dryer, picnic table, whatever you got, top of their crate. You can do this with a big dog on the floor as well. And this is how I restrain almost all my patients. Either my thumb or either my thumb going down through it if I need a little extra strength. It's going to put all your pressure here, doesn't interfere with breathing. Or I'll take my middle finger and go up through it if I want to support their head and look at the fine things of their head, and then I put my thumb on one side of their face, my pointer finger on the other. So you can see when I'm doing this, you can't really see his collar because he's very hairy. And his is a little bit of a pain because it's got a GPS unit on it, so I'm gonna roll it up there. But you can see right now I've got pretty good control of his head. If he wanted to flip around and wiggle, I'd just wait. I would let him flip around and wiggle. But this lets me stabilize his head. I can look in his mouth, and all you have to do when you want to look at their gums is lift their lip just like that. See, you've got a beautiful view of their nice pink gums. I know he needs a dental. It's on our list. You can look in their eyes. You can look in their ears. And so for a puppy, when I start out, I'm just going to hold on to this collar a little bit. I'll usually rest my elbow on the table because they're going to wiggle a little bit. I'll let them wiggle. I'll wait till they're done. As soon as they're standing still, good boy, I'll praise. And then I do a lip, eye, ear, and literally that's all I do for a puppy on that. That's session one. So what did that take? Five seconds once he stopped wiggling. And then I would move on to step two. But for your adult dogs that you need to do something to, if you need to put eye meds in the eye, you can use that thumb to pull the lower lid down, the heel of your hand to pull that up, put a drop in this way, or on this eye, you use your pointer finger, the heel of your hand, drops or ointment. Same thing with ear meds. Flip the ear back, put your meds in the ear, squeeze to work them down, drop your tube, and then just massage to work it down in the ear. So easy peasy, you've got control. You can tell Scotty's very used to this. He doesn't love it. Is he gonna jump up here and offer to do it? No. But is he gonna be mugging me for a cookie and happy as a lark as soon as I put him down? Yes. Is he particularly stressed by this? No, it's part of life. So for a puppy, step number two is pick up the foot and hold it. And there is a sweet spot for this. Age-wise, once you get beyond, depending on the puppy, some will start to resist. All puppies are gonna resist. All puppies are gonna wiggle and they're gonna yip a little bit. And that is normal. Puppies are dramatic. They put on a dramatic display to say, I'm only little, please don't kill me. But they're also very resilient. And so what I normally expect to see is the puppy wiggles a little bit, yipes a little bit. Then the next thing they do is they try to climb on your head and be a hat. I just extend my arm. I don't let them do that. And when they hold still, I'm like, good dog. As soon as they're still, they get the paw back and we go to the next paw. When you get beyond that sweet spot, you usually have till at least 9 weeks. Most of the time you have a little older till they're 10 to 12 weeks. And occasionally as late as about 14 weeks. But if you get beyond that point, you're gonna get a puppy who gets really agitated, who's very fearful, who may try to aggressively bite, and they're all gonna try to mouth you a little bit. I don't even worry about that. But if they're aggressively biting, if they certainly are afraid enough that they pee or express their anal glands, don't do it this way, because you don't wanna create a negative emotional response to this. All you wanna do is give them an idea that not everything is their idea, that it's not the end of the world, that cooperation gets it over with quickly, and it's no big deal. So 3 to 5 minutes, actually probably less than 3 minutes. I start at 7 to 8 weeks whenever I can bring that puppy home. I like to have my puppies, for me personally, in my situation, I usually have them coming home to other dogs. I prefer to get them between 7 and 8 weeks. That's not appropriate for every home situation that they go to, but I want to get them so I've got plenty of time to get them before that fear imprint period starts at 8 to 10 weeks, and when I'm still in that sweet spot. So I'm just going to pick them up, and I'm not going to belabor the point. I'm not going to trim every nail that they've got. The first night I'm probably not going to trim any nails. I'm just going to pick up the foot, hold it, maybe look at the toes a little bit, give it back as soon as they're still. Pick up the foot, look at the toes, give it back. Good boy. You notice I don't have treats in my hand. I don't have treats in front of them. Good boy. Good boy. Once we're done, yay! They get told how wonderful they are. Then they get a big jackpot. I don't distract them with treats when I'm teaching restraint, because I want them to notice what I'm doing and realize it's not the end of the world. And this is a good way with puppies to introduce small manageable amounts of stress that they can be successful in working through, and you get a dog who's much more resilient to stress, much less stressed by handling. I am a big positive trainer, but this is one area that this is not 100% positive reinforcement, because life is not 100% positive reinforcement, and they need to occasionally know that not everything goes absolutely according to their every whim. When I get a dog who comes into my clinic, they're usually stressed, not because we do a lot of painful stuff to them, but they're stressed because they don't get out a lot and new situations are scary for them. So that's one thing to think about, is letting your dog get out and see enough of the world that it's not a trauma just to take him out of the house. And they're stressed by being asked to tolerate restraint, because the rest of their life, the rest of the year, nobody asked them to do anything that wasn't their idea. And so it makes their visit here much more stressful. It makes our lives much more stressful. It's going to make your life hell the first time you have to do something like poke a pill down their throat or get meds in their ears or their eyes. 3 minutes a day, starting the day you bring that puppy home. By the end of week 1, and certainly by the end of week 2, you're going to have a dog who's pretty tolerant to handling, and you just practice it a little bit here and there. It's no big deal. And you can see he stands here nicely. If I needed to, I could put an IV catheter in without anybody to restrain him. I could draw blood. I could probably put in a urinary catheter. I could with all my other dogs. Scotty is not quite as good about it as they were, but I probably could if I needed to. I might have to be just a little bit sterner about it with him. But in this way, you can see there's no struggle. There's nothing big. I could get out the Dremel and do it right now, except we did them pretty recently. And he would pretty much stand there. He does like to lick the Dremel, which I would prefer he not do. That makes it a little bit of a pain in the ass. But other than that, he doesn't resist or anything. And, you know, everybody that comes in, I put their dog on the table, they want me to trim their toenails, and they say, oh, he hates having his feet handled. Well, no shit, Sherlock, pardon my French. Because you didn't teach him to tolerate having his feet handled. You didn't do your job. Sorry, I'm blunt. I'm not always that blunt with clients, but I'm being blunt here. It is your job to desensitize your dog to that and not make... Because the problem is, you come in with your dog that never has his feet handled, has never been taught to tolerate it. He comes in, we have to pick up his feet and then trim his toenails, which are 10 miles long and have a quick that's out way beyond where it should be. And so he's flipping around, having a tantrum, pulling his foot away, and every time he does that, it makes it harder and harder for us to shave off just a little bit at a time and be cognizant of getting close to that quick but not hitting it. And so he jerks and we hit the quick and it hurts, and then he has a negative emotional response, and it builds. So at this stage in my career, I don't wrestle dogs for nail trims anymore. I will do cooperative small dogs, and I will do very cooperative big dogs if I have the strength in my hands on a given day. And beyond that, if they're not cooperative, You can take them to a groomer who can work with them. You can teach them to do it at home, or we can sedate them and do it. But I'm not wrestling them for my benefit and for their benefit anymore. So, but that's how you start conditioning your dogs to this. I would show you with a puppy, but we don't have any puppies coming in today. And pardon my dog's fuzzy ears. But you can see that I can do lots and lots of stuff to my dog this way. I also teach them, the other thing I teach puppies is I teach them to be a dead dog. Come here, Scotty B. This is a very handy skill to have. So with a puppy, I will pull them up against my body. Good boy. I will reach under them. I know. And I will grasp that rear leg closest to me, and I'll just slide them right down my body. Good boy. And then I'll reach under them and get this foot. Good boy. When you've got them lying on their side, if you hold the leg closest to the table, front and back, with your arm over their neck, then you can restrain here pretty safely. You're not putting any pressure where they need to breathe. But this is what you do if you have to wrestle the dog and restrain it. I want to teach a dog to lie this way. So with a puppy, I'll just slide them down my body. I'll let them lie like this. I rub their belly and their chest. And as soon as they relax, okay, good boy, and I let them up. That's all I ask for them to do. And I want to make it, it's a little more awkward with a dog as big as him, but when you start with a little puppy, it's very easy, and I'll just sort of cradle them in my arms and slide them down that way, and just sort of transfer them from being cradled on my chest to cradled on the table. And then I just ask them to lay for a little bit longer and a little bit longer before I release. And then I might let them lay there for a minute or two and feed them a cookie while they're lying there. And then I might get out a brush and do just a couple swipes with the brush. I'm not going to do a full groom. But at this stage, I can lay him down on the table. I can tell him to be a dead dog, and he'll lay on the table for an hour while I brush him if I need him to. Nice, easy peasy way for both of us to get it done. I know you've been very good. You're the bestest boy. Are you ready to get down? Mm-hmm. And come here, babe. Oh. All right, down you go. So when I put him down, he's looking for his cookie. He's not stressed. He's happy. He did his job. It's not his favorite job. I don't care if it's his favorite job. Going to the dentist isn't my favorite job, but I go to the dentist. I'm not overly stressed, and I go back to my life. That's what we want for dogs when we need to do things to them to restrain them. So there you go.